Around 20% of those who go through some form of psychological trauma will most likely develop PTSD. Although early diagnosis and intervention can significantly improve outcomes, PTSD is a treatable condition. With proper support and treatment, individuals with PTSD can live a fulfilling lives. It is very important to understand the cause before you treat it. So let us discuss the major cause of developing PTSD. So the causes could be psychological response to any traumatic event, which may overwhelm the brain's coping mechanisms. That then leads to hyperarousal and difficulty in processing the experience that people have gone through. Then there are some genetic and biological factors where some of the people who have a genetic predisposition or perhaps a biological vulnerability that makes them slightly more susceptible to develop the condition. Equally, social and environmental factors can also affect, with that include lack of support or exposure to ongoing stress after the trauma can worsen symptoms. So let us talk about what the symptoms of PTSD are. The most common ones are reliving experiences in the form of intrusive thoughts or memories, which may include flashbacks, nightmares, or perhaps unwanted thoughts or images of the traumatic event. Emotional distress when they are reminded of that trauma is one of those things. The other key thing that we look at is avoidance, and what that means is people start avoiding places, people, activities, or any situations that remind them of the trauma. Feeling numb or emotionally detached, or having loss of interest in activities that you once enjoyed. Difficulty maintaining relationships can also be part of that syndrome. Now, negative changes in the thinking and the mood can also affect and be part and parcel of this syndrome. Hopelessness about the future, having guilt or shame, developing memory problems, including difficulties in remembering details of the traumatic event, are all part and parcel of this syndrome. The other things could be changes in the physical and emotional reactions that people have, and one of the key things that we look at is hypervigilance. That is, people are always on the guard and watchful for their safety. They may have an exaggerated startle response, easily getting irritable or having angry outbursts. Sleep difficulties are very, very common. Difficulty controlling their thoughts or emotions, or perhaps having physical symptoms like headaches, stomach aches, dizziness, or other anxiety-related problems. So if you think you or someone you know might have PTSD, seeking professional help is absolutely crucial, because that would allow you to see a medical professional who would be able to diagnose and help you. So if you know someone who's going through a similar situation, share this video with them and help them overcome this situation. Subscribe to my channel for more of this content, and don't forget to hit that notification bell, and let's stay in touch.